absolutely diseases, just like any other disease. And kind of the layperson way I explain it, the simplest way I explain it, diabetes is a disease of the pancreas, where your pancreas doesn't secrete the right amount of insulin. Mental illness and addiction are diseases of the brain, where the brain is not secreting the chemicals correctly. They are very, very similar. In the case of mental illness, what's happening is the chemicals either aren't secreting correctly or are not able to be taken up and used correctly. In the case of addictions, what's happening is because of what we consume, it causes chemical reactions to happen that otherwise wouldn't have happened in the brain. But these are metabolic diseases just like any other disease. I'm going to spend a little more time on that in just a second. But the first thing I'm going to show you is some pictures. I am actually a visual learner, and I know many people are, and sometimes it really helps just to see what I'm talking about. And I actually think because we couldn't see the brain for so long, I think that's part of the reason why people developed this stigma and this understanding, and actually misunderstanding, of what mental illness and addiction really were. Because what we could see are the outside symptoms. What we could see are the outside symptoms. We couldn't actually physically see what was happening in the body, but now we can. So what you're looking at is you're looking at two pictures of the brain. And the brain that's on the left, on your left, I have to turn my back to you for just a second, or my right and left is opposite, but the brain on the left is what a healthy, normal brain looks like. You want to see all the different colors lighting up. That's actually a picture of metabolic functioning happening in your brain. You want to see all the different colors lighting up. The brain on the right is someone with untreated schizophrenia. And you can clearly see that the brain is not functioning the same way when they are not receiving treatment. These are a couple other pictures, and these are pictorials. These aren't actual brain pictures. They're redrawings of the brain pictures, but it shows you the different things that are happening in the brain in terms of the chemical issue with different disorders. So again, the top middle, you see what a normal, healthy brain looks like and what you want to see the colors look like. The brain that would be on your right is someone with bipolar disorder, where all that extra red is lighting up. The brain on the bottom is someone with obsessive compulsive disorder, OCD disorder. And the brain on the left is someone struggling with depression, and you can clearly see the lack and the change of the way that chemicals are lighting up. These pictures are actually going to show you addiction. And one of the things I do in these pictures is I actually start at the bottom. So we're going to start at the bottom left, and what you're looking at is a healthy heart. Because I'm going to show you, when I say these are diseases like any other disease, you're going to see what metabolic functioning of a diseased heart looks like, and then you're going to see what metabolic functioning of a diseased brain looks like. So a healthy heart is what's on the bottom left, and you see all that red, that's what you want to see. The bottom right is someone who is struggling with heart disease. And you can see that the red is not happening. The metabolic functioning is not happening the way it's supposed to. Now look at the brain on the top left. You're looking at what a healthy, normal brain looks like for this particular picture, and you want to see lots of what I actually call it neon green. So it's kind of that yellowish green is what you want to see. But the brain on the right is someone who's struggling with untreated cocaine addiction. And you can clearly see that the brain is not functioning the same way. But my favorite picture of all the pictures I have is this. And the reason that it's this is because not only does it show that the disease happens in the brain, it shows that recovery from the disease happens in the brain. Because recovery does happen every single day for thousands of Oklahomans. And I'll talk to you about that in just a second. But what you want to see in this is, I'm not going to get real medical on you, but you're looking at dopamine transporters. And what healthy, normal dopamine transporters look like is that dark blue outline, that light blue middle, and what I call a lot of that concentrated hot pink. That's what you want to see looking at the brain on the left. That's what healthy, normal dopamine transporters look like. The brain in the middle is someone who's been struggling with methamphetamine addiction. They've actually been clean and sober a month at the time of this brain scan. But you can see that the dopamine transporters are not functioning normally. But the amazing thing is the brain on the right. 24 months into recovery, these dopamine transporters are returning to normal functioning. The disease happens in the brain, just like the disease of diabetes occurs in the pancreas, heart disease, obviously the heart, asthma in the lungs. Mental illness and addiction are diseases of the brain. It's just a different organ in the body. And they can be treated as successfully and often more successfully than other diseases that we have. But most people don't know that. We're going to talk about that. So why is this even an issue in Oklahoma? Why would you invite me here, other than you're just very kind, to speak to you today? Well, Oklahoma is actually number 2 in the United States for the number of people who are struggling with mental illness. We're number 2 in the United States for the number of people struggling with severe mental illness. And when I say that, sometimes people think, well, how is that possible? And I say, well, it's pretty simple. Have you seen all of our health statistics? We're usually ranked 48th, 49th, or 50th in overall health. That measure is not good. You want to be towards the top in that measure. We're usually ranked 48th, 49th, or 50th. In fact, a few years ago, we were ranked 43rd, and we were super excited because we'd moved up to 43rd, right? We have high rates of all diseases in Oklahoma. We are not a healthy population. So it's not surprising we have high rates of mental illness and addiction because these are diseases like any other disease. In fact, what would be really weird, given how poor our overall health is in our state and how many other diseases we struggle with, is if we had these really low rates of mental illness and addiction. So we had these really bizarrely healthy brains trapped in these really unhealthy bodies, right? That would be weird. But it's not the way it works. As long as we have poor health in our state and we have high rates of all diseases, we're going to continue to have high rates of brain disease. We're going to have high rates of mental illness and addiction. So what does that mean? So before I give you these stats, because one of the things I normally do, I'll just tell you right now, I pretend to be cool. You're going to know right now, I'm not. You can out me to anyone. I am not cool. I am one of the biggest data nerds I know. I really like data. I like math. I have this bizarre love of math and always have. I took these nerdy advanced math classes my whole life. And so everything that we do at the department is based on data. Because we have so few resources, we have to figure out where we're going to make the biggest impact. We have to account not just because we are accountable to taxpayers, which I feel very strongly about, that we can account for every penny that we have, but because we have to stretch our dollars as far as possible. So what the statistics say, I'm going to use a lot of statistics in my presentation because I know them, because like I said, I spend a lot of time looking at this kind of information. About 21% of Oklahomans on any given day are struggling with mental health issues. About 21%. The latest study that came out actually said 22%, but it's about 21%. So that's 1 out of every 4 of us that struggles with mental health issues. About 12% of our population, 12% of our adult population struggles with addiction issues on any given day. About 12%. So 1 out of every 10 of us is struggling with an addiction issue. And in fact, and I won't ask you this because I don't know you well enough, but once I know you well enough, I will ask you to volunteer. But I won't do it today. Just odds are, because it's 1 in 4 of us, there are people in this room today who are struggling with mental illness and addiction. More than likely, there are people in this room who are in recovery from mental illness and addiction, because the fact is, people who are in recovery are heads of companies, they're policymakers, they lead families, they lead communities of faith, they're vital parts of our lives. And if you can't think of someone sitting in this room who you know is in recovery, think about your family. 1 out of every 4 of us struggles with mental illness or addiction at some point in our lifetime, so it affects every single one of us. What that means is that there are between 700,000 and 950,000 Oklahomans who struggle. And I normally use percentages, and when my staff gave me this stat about 1.5 years ago, for whatever reason, they put it in the number form, and this is my 8th year as commissioner, and it hit me in a completely different way. I had never said the numbers out loud. I'd always said the percentages. It's between 700,000 and 950,000 people struggling each year in Oklahoma with mental illness or addiction. Of those, approximately 190,000 were able to receive services last year. About 190,000, which is amazing that we helped 190,000 people, but the gap is huge. The gap between the number of people who need services and who get services is enormous. The gap between the number of people with the healthy brains you saw and the people who are struggling with a disease is enormous. Yet with treatment, we can change all of that. So let's talk about drug addiction for just a little bit. And I'm giving you snippets. I could actually stand here for about 4 hours. But I'm pretty sure that there might be only 1 or 2 people left, maybe a couple of people I contract with, Brian Blankenship, who's in the room, who runs counseling and recovery services, Mike Brose, one of our amazing partners at the Mental Health Association of Oklahoma. They may be the only 2 left, and that's probably only because we contract with them, right? No one's going to stay here for 4 hours. So I'm picking some snippets that I think are pretty important for you all to understand as it relates to our state as a whole, but I'm going to focus on Tulsa County. Oklahoma ranks number 4 in the United States for the highest rate of prescription drug abuse. And when I talk about prescription drug abuse, I'm talking about prescription painkillers, opioids, hydrocodone, oxycodone, OxyContin. Prescription painkillers is what I'm talking about. We are number 4 in the United States. In fact, a report was released this morning that said we're number 2. But we are number 4 in the United States. Our deaths, our overdose death rate, dying as a result of prescription drug overdose, is one of the highest in the nation. And what happens when you take too many painkillers, let me explain what happens. When you take too many prescription painkillers, too many hydrocodone, too many OxyContin, it basically slows your respiratory system. And when you take too many, you stop breathing. And that's why you die. That is what the overdose is. You stop breathing because of the amount that's in your body. In Oklahoma, more overdose deaths involve hydrocodone or oxycodone than all other drugs and alcohol combined. We had more people in Oklahoma who died as a result of prescription drug overdose last year than died in car crashes. We had more people who died as a result of prescription drug overdose in Oklahoma last year than died of car crashes. And in fact, when you look at it, it's actually the leading cause of death by injury for Oklahomans between the ages of 25 and 64. It's the leading cause of death. Guess what? In Tulsa County, 21% of all prescription opioid analgesics in the entire state, 1 out of every 4 occurred in Tulsa County. Tulsa County actually has the highest prescription drug overdose death rate of any county in Oklahoma. And to give you a context of what that means, Tulsa County's prescription drug overdose death rate is the 18th highest county in the United States. Of all counties in the United States, Tulsa County is the 18th highest in terms of prescription drug overdose rates. You may have seen, in fact, I think the next slide talks about it, we are doing everything we can to focus on this issue. And Tulsa, your community, many of your leaders are stepping up as well. A few months ago, Mayor Bartlett, and I hosted what was called the Mayor's Prescription Drug Summit. Some of you may have seen it. It was over at the Schusterman Center. And we brought in all different types of entities. We brought in and partnered with the Chamber of Commerce. We partnered with education. We partnered with law enforcement to have everyone talking about this issue, the medical community, because it is a significant issue and a preventable cause of death and a treatable disease if we all understand what's going on. Because there's such a high overdose death rate in Tulsa County from prescription drug abuse, there are many things we're doing, but one of the things that we're doing is we received a small amount of funding from the legislature 2 years ago, so thank you to Senator Crane and Representative Mulready who are here today. And if there's any other legislators, I apologize, I didn't see you. But we received a small amount of money to address prescription drug abuse 2 years ago through the legislative appropriations process. It was championed by the governor and several legislators. And while it was a small amount of money, again, being that data nerd, we decided, okay, where can we have the biggest effect? And it's Tulsa County, obviously, because it's the highest overdose death rate in Oklahoma. And so we looked at it and we said, okay, what can we do? And there's an amazing product called naloxone, Narcan, if you haven't heard about it. It is a nasal spray that forces people to breathe when they stop breathing due to an opioid overdose until they can get to the emergency room. That's what happens. And in fact, if you attended the summit, you'll remember this story. If you didn't, there was an incredibly powerful story, and I don't wish it was mine. I wish I had been the teller because I really like being a public speaker, and I got blown out of the water at this summit. And I got blown out of the water by a woman named Gail Box. Gail Box is Austin Box's mother. Austin Box was the very well-known OU football player. He was the linebacker for the University of Oklahoma who died as a result of prescription drug overdose about approximately 3 years ago. Austin, like many football players, was injured. He was a very good, very serious football player, and he'd been injured several times, but like many football players do, he would play through the pain until he broke one of his vertebrae or injured his vertebrae. And when that happened in 2010, in order to continue to play, he was prescribed prescription painkillers. The problem is, we can't see our brains just sitting in this room, so we don't know which out of every 10 of us is going to become addicted. We know it's 1 out of 10. We know 1 out of 10 of our brains has a chemical makeup that when these drugs enter our body is going to cause something to happen that doesn't happen in the other 9 brains in the room. And we're going to become chemically addicted in our brain. And Austin, unfortunately, was one of those 1 in 10, but of course didn't know it. His parents didn't know it, and he began taking prescription painkillers, and he died within 6 months because of how quickly he became addicted, which is what happens for people who have one of the 1 in 10 brains. And he died as a result of a prescription drug overdose death. And Gail told her story at the Tulsa Summit after Mayor Bartlett and I had spoken. And what she said is, had we known about Narcan then, had we known about naloxone, which is the nasal spray that forces people to breathe until they can get to the emergency room, she said it may have saved Austin's life. It may have saved Austin's life. And so what we did with the small amount of dollars that we had, and you may have heard about this, is we chose Tulsa County to be our pilot. And we did a partnership because previously the way the state law read is the only people who could have naloxone were physicians. And so the people who had it were emergency room physicians, of course, because if someone comes in and isn't breathing due to the opioid overdose, you want to administer that. But that meant everybody on the way there didn't have it. So the law was changed, again, thank you to our legislators who said, you know what, we're going to allow first responders to carry this. It truly is a miracle drug. There are no side effects if you're given it incorrectly. Nothing happens if you're given it when you don't need it. But what it does is allowing our police, our emergency responders, allowing our fire departments to carry this, they have it when they get to the scene. So we've trained all Tulsa, the Tulsa PD has partnered with us on this, and they have trained all of their officers. Every officer in Tulsa, as well as the sheriffs, are all equipped with naloxone now. And since April, when the pilot went live, after all the training had happened, there have already been 14 lives saved in Tulsa County as a result of the naloxone pilot. And when I tell the story, because sometimes one of the things we struggle with what people think of when they think of addicts is they have this image, kind of a stigmatizing image. And the fact is, addiction looks like you and it looks like me. That's what addiction looks like. And so the 12th save in Tulsa County was a gentleman who was over 60. He's actually a pastor of a church. And he had multiple medications, including a prescription painkiller, and he got confused one day, and he took too many of those when he was trying to take all his medications. And he was driving to his church, and he called 911, and he said, something's wrong, I'm pulling over, this is the parking lot I'm in. And he stopped breathing. And the police got there, and they administered naloxone, and they saved his life. So naloxone saves lives of people who truly are struggling with addiction, and it saves lives of people who accidentally overdose. And Tulsa County is now one of it's obviously our pilot, but it is one of the places the nation is now looking because of what your law enforcement is doing to save lives as a result of prescription drug overdose. So let's talk about, there's so much to talk about, but let's talk about mental illness for just a second in the workplace. And actually, let me go back one time. I want to say something about addiction. Because a lot of times when I talk, people say, okay, I understand that mental illness is a disease. I may not know someone with schizophrenia, but I understand that schizophrenia is a disease. I probably know someone with depression and major depression, so I understand that depression is a disease. But isn't substance abuse really a choice? I get that question a lot. And here's what I think is really important. My answer isn't actually no, it's not no. It's that initial substance abuse is absolutely a choice. Initial substance abuse or alcohol use is absolutely a choice. But what happens for 1 out of every 10 of us, if we were all over 21, which I'm assuming we are, except for your young Rotary members. I'm just kidding, I know, I'm a Rotarian, we're all over 21. And I served wine at a dinner table. 9 out of 10 of us, if there are 10 of us sitting around the dinner table, 9 out of 10 of us would feel the effects from the wine, but our brain would metabolize it exactly like it's supposed to. But for 1 out of every 10 of us, when that alcohol hits our bloodstream and then hits our brain, it causes a chemical release that doesn't happen in the other 9 brains. And the chemical release actually releases a chemical that craves more alcohol. And you use alcohol if you have one of those 1 in 10 brains. The next day, the next month, the next year, every time you use alcohol, if you have one of those 1 in 10 brains, it causes that chemical release to happen. And eventually what happens is that chemical release starts happening on its own. And people become chemically dependent on alcohol because, think about this when you came in. Let's say you hadn't had a drink of water, of anything, in a couple hours, and you walked in, and you see that cup of water sitting on your table. Do you think to yourself, wow, my brain just released a chemical that told me I was really thirsty? No, it just happens. You know you're thirsty and you need water. That's what it feels like when you have one of the 1 in 10 brains when you see alcohol. It's not anything you can consciously control. It's not like you can go, okay, brain, stop secreting that chemical, right? Now, actually, you kind of can once you get into treatment. It's amazing what our brain is capable of doing. But without understanding it, without getting help, it is incredibly hard. It is incredibly hard. And so when we talk about, is it a choice? It is a choice initially. But if you have one of those 1 in 10 brains, it becomes a chemical dependency that requires treatment. And when we talk about this, I also talk about AA and NA, because sometimes when I'm talking, people say, well, that's not treatment. There are people who amazingly white-knuckle through the process of changing their brain chemicals, and we actually do have the power to do it, but it is incredibly, incredibly challenging without getting medical care. And here's the kicker, and truly, and I don't say it facetiously, the killer on alcohol issues or other drug addiction issues. It is absolutely a choice seen it the first time. And do you know what the average age in Oklahoma is that people take their first drink? Yeah. It's 12. It's 11 for boys and it's 13 for girls. It's 11 for boys and it's 13 for girls. And that's not your first sip, like a taste. This is your first real alcohol use. The average age in Oklahoma is 12. So imagine being a late bloomer and your first drink is at 17, okay? Imagine how many times, if you have one of those 1 in 10 brains, that chemical reaction has already occurred in your brain before you even hit your 21st birthday. And so when people say, is substance abuse a choice? I say initial substance abuse is absolutely a choice. And what are the other choices in Oklahoma that we make at 12 years old, and we look at people and we blame them for the rest of their lives? What if I told you you had to marry whoever you wanted to marry when you were 12? Right? Think about that for a second. I always say I would be fine. I grew up in the 80s. I wanted to marry a movie star, so I would be just fine and I would be rich. If you're anywhere near my age, I will tell you I wanted to marry Corey Feldman. So now you know that I really wouldn't be because he has huge drug and alcohol issues, right? So I wouldn't really be all that great. Or if I told you you had to have whatever job you wanted to have when you were 12 years old. Well, at least in Oklahoma City right now, we'd have a lot of really lousy professional basketball players because the Thunder has taken over Oklahoma City, which is awesome. But 12-year-olds want to be professional sports players, right? Nobody looks around at 12 and says, I want to be the chief financial officer of a big company when I'm 12. I might have, I was a little bit nerdy. But other than that, most people don't say that. And so think about but for people who use alcohol at 12 years old or 15 years old or 17 years old, who have no concept of what might actually be happening in their brain, and at this point, we don't know who the 1 in 10 brains are or any way to tell that or have a test. Imagine what's happened by the time they're addicted when they're 21. In terms of mental health, let's talk about workforce for a second. Mental health is actually the leading reason for lost work performance, and it's the second leading reason for absenteeism for all categories of employment. So if you're an employer, and I'm an employer, I have 1,800 employees. Most of our business is done through private nonprofit contractors or private for-profit contractors. But I have a handful of state-operated facilities yet. And I have to have people present in order for them to be productive. It's not a particularly productive day when my staff call in sick, right? The second leading cause for absenteeism in every workplace is untreated mental health issues. In 1995, the University of Oklahoma did a landmark study, and they found that for the 200,000 Oklahoma workers who are dealing with depression and addiction, Oklahoma employers are spending an extra $600 million annually on the cost of lost workplace productivity, on additional healthcare costs, because when you have untreated brain diseases, you develop a host of other physical diseases. Persons with untreated mental illness are 2.5 times more likely to develop cancer than someone without mental illness. Persons with untreated addiction and mental health issues are much more likely to develop diabetes. All of these things cost employers more on their bottom line and significantly more than it would have simply cost to treat people in the first place. Nearly, as was mentioned earlier, nearly 75% of all adult illicit drug users are employed, as are most binge and heavy alcohol users, and general alcohol users, 85%, alcoholics, 85% are actually employed. So this absolutely affects your workplace and your bottom line. Absolutely affects it. In 2008, mental health problems were one of the top 3 leading causes for workplace disability. You know, as employers, we have to pay for disability and those things for employees. One of the top 3 reasons is mental health issues. It has been predicted that by the year 2020, mental health problems, in particular depression, will be the leading cause of workplace disability. And the kicker on this is, it doesn't have to be. Because if people have access to treatment, they can and do recover, and they can be full and productive citizens and employees. In fact, so much so that one of our leading companies in Oklahoma, or one of our big companies in Oklahoma City, is Chesapeake. Chesapeake did some amazing things that they have won state, but more importantly, national awards for. And about 4 years ago, they said, actually maybe more now, so my time seems to run very quickly, but they said, something's going on in our workforce, and we realized mental health and addiction issues need to be addressed. And so from the top down, they first negotiated their insurance plan and made sure that they had really good mental health and substance abuse benefits for their employees and their immediate families. Because they also realized that when an immediate family member had an untreated mental illness or addiction, people were not paying attention at work because they were so worried about their family. So they made sure that their insurance had really good benefits. And then from the top down, they sent message after message to employees, including video messages from the CEO. They got Desmond Mason, another basketball player, to come in and do video messages that went to all their employees that said, the same way we care about your health of your heart and your health overall, we care about your brain health. If you or your family member is struggling with mental illness and addiction, we can help you. We have great insurance so that you can access care. And the calls to their EAP line, their employee assistance line, employee assistance programs or counseling programs for employees, went from 400 calls the year before to over 4,000 calls the next year. And they are so proud of the work they've done because they have people who are in recovery. They have their employees' families who are in recovery. They know that this has made a significant difference on their bottom line, and they are willing to share this information with any company that asks. This is an employer issue. This is an employer issue. Offering EAP programs make a huge difference. And it's not just enough to offer an EAP program. You have to get the message somehow to employees that there is no stigma to accessing this program. The same way if one of your coworkers or someone who worked for you had cancer, your employees would do whatever they could to support them, whether it would be sending care baskets, whatever it might be. The same message needs to go out around mental health and addiction. Because what we know is that when people access EAP programs for mental illness and addiction, sick leave goes down by 33%, meaning they're at work. Work-related accidents go down by 65%. Worker compensation claims go down by 30%. And study after study show what a huge difference EAP programs make on the employer's bottom line, not to mention what it means for that employee. Not to mention what it means for that employee. The other thing, because I got to pick two topics, so I picked employers and the criminal justice system. Not because I'm saying they're directly related, but because they're two of the most pressing topics in Oklahoma right now. The biggest cost to taxpayers around mental illness and addiction is that we pay to put people in prison instead of paying to put them in a medical facility. People are more likely to end up in the back of a police car, the inside of a jail cell, or the inside of a prison cell if they have mental illness and addiction than they are to ever end up inside of a medical facility for that disease. That's what happens in Oklahoma instead of treatment. And because we are only able to reach 189,000 of the 700 to 950,000 people struggling, that's a lot of people that our criminal justice system, our judge, our police officers are struggling to try to deal with. So we created a Smart on Crime proposal. Our Smart on Crime proposal says, and you've heard a lot of talk about this lately, there is a better way. There is a better way than incarcerating for someone with a disease. We've got to catch them early. I don't mean catch them committing crimes, I mean identify the diseases earlier, although it could be that we can catch them committing a nonviolent crime, and we get them into treatment instead of putting them in a very expensive criminal justice system. In fact, what we know about drug courts, the annual cost of drug court, and you guys have amazing drug courts here in Tulsa County, the annual cost of drug court is $5,000 a year per person. The annual cost of prison is $19,000 a year per person. Drug courts are significantly less expensive to us as taxpayers, but more importantly, they're more effective. They cost less and they're more effective. In fact, what we know is that we did a study, it's about 670 drug court graduates that we picked. We actually have 4,000 people in the program on any given day across the state, but we picked 670 graduates and we studied their income for 3 years. And what we found is after they graduated the program, they earned, between those 670 people, $23.5 million in wages over 3 years. And they paid back into the General Revenue Fund $1.4 million over those 3 years. Had they been in the prison system for those 3 years, they would have cost us as taxpayers over $35 million. And instead, they paid back in $1 million. More importantly, drug court is more effective at stopping future crime. This study is 3 years. 3 years after graduation, 3 years after graduating drug court, we looked to see how people are doing. We didn't just look 30 days later, right? Because 30 days later, surely people are still doing well. We looked 3 years later. And we compared people who graduated from drug court after 3 years to people who had served their full prison sentence for the same crimes and been released, and said, where are they 3 years later? Only 6.5% of drug court graduates had been reincarcerated, and 23.5% of inmates had been reincarcerated. Drug court is by far more effective at preventing future crime. It is by far less expensive to taxpayers. We have members of the legislature who have fought for this in this room, but they need additional support. They need to hear from people to say, we want you to fund this instead of prison. Because something happened in Oklahoma and around the nation in the 90s where everyone started demanding people be tough on crime. I have a 5-year-old little boy. He's the cutest little boy in the whole room. I'm sure someone will argue with me, but I'm right. He is the cutest little boy in the whole wide world. And I don't want anything bad to ever happen to him. And I know that there are people out there who are dangerous. There really are some people who are dangerous that need to be locked up to protect my son. But there are a lot of people who I get to decide if I want to spend $19,000 a year to incarcerate, who are not dangerous, but have a disease, or if I want to spend $5,000 a year to put them in drug court. But until we get legislators the message and enough support to say, this is what we want, we are educated taxpayers and we know it works better and it's less expensive, do this so that we have money for our education system and our roads and other things. Until they get that message, they're in a very difficult spot because there was this big outcry for a long time to lock everybody up who uses drugs. It doesn't work, and we're going to go broke if we stay on that same path. I'm going to skip because I know I'm running late on time. But one of the things that we know, here is the cost of treatment. It's about $2,000. This is average outpatient treatment for someone who is not at the level that needs drug court. It's about $2,000 a year per person. Drug court is that bright blue line, $5,000 a year per person. Mental health court, $5,400 a year per person. One single hospital stay when someone shows up at the emergency room because they couldn't get care in the community, $15,000 a year. One person incarcerated is $19,000 a year. One child in the foster care system is $21,000 a year. And why do I mention foster care? The number one reason kids are in foster care is actually neglect. It's not abuse. And a lot of times there are tragic abuse stories of kids who do need to be removed from their parents, but most often it's neglect. And 80% of the people who have their child removed for neglect have an untreated substance abuse issue. They weren't abusing their child. They were neglecting their child. They had an untreated disease. And if they can get help, if Judge Francine could have resources to send these families to, they can be full and productive citizens and parents where we're not paying for children to be raised in foster care because, let's be honest, foster care is not a good place to be raised. Even if we had never had anything go wrong in foster care, and I'm actually not talking about when things go wrong in foster care, but foster care away from your family, the separation of a child from their mother has lasting effects on that child. There are some cases when it really is the right thing to do. But most often, getting treatment for people will cost us significantly less money, and it will make a huge difference not just in the life of that parent, but it lowers the chances significantly that that child ever becomes an addict as an adult. And so we have to decide where we encourage our policymakers to spend our tax dollars. The last red bar is what it costs to actually incarcerate a person with severe mental illness a year. I'm always very conservative in the sense that I don't ever overstate our savings because I never want someone to say, they overinflated that cost. So I compare drug court and mental health court to the basic prison cost of $19,000 a year, and I show you what the savings would be. It actually costs $23,000 a year, according to the Department of Corrections, to incarcerate someone with severe mental illness because of all the additional medication and other expenses that they're required to do. There is significant savings to be had, and there are better ways to do things if we get people access to treatment. If we understand that mental illness, it does look like you and like me. Now, if we have mental illness and addiction and it goes untreated for years, and we aren't fortunate enough to be people who have families who can help support us, it might start to look like the stereotype you might think of in your mind when you think of mental illness and addiction, of someone who's homeless, and there are people who are homeless with mental illness and addiction. But if you think that's the only people with mental illness and addiction, you need to go back and look at your workforce, because 75% of all people who are addicted to illicit drugs are employed. 85% of all people who are addicted to alcohol are employed. It's you and me, it's our families, and we have to decide that we're going to learn what these diseases are and that we're going to demand they get treatment the same way any other disease gets treatment, because treatment absolutely works. Thank you so much for letting me be here today.
Well, I don't know about you, but I was very educated today. That was very eye-opening. Appreciate you coming. A book recognizing today's program will be presented to our partner in education school, Celia Clinton, and the book is called The Giver. Very appropriate for today. Upcoming programs, next week is Sherry Mixa, president of Mazios. Be sure to come next week. And then the following week on February 11th is Greg Weber, managing director of Tulsa Opera. As we conclude, I hope you enjoy Pocket Full of Sunshine, which goes with the day today, for some Light Up Rotary fun. We are adjourned.